Hi guys, so today we're going to talk about good reasons to go on birth control. Something that I just want to point out is that most women, like when we mention birth control, they assume that all we are referring to is the pill. So the main reason that most women go on birth control is for pregnancy prevention, of course. Another reason to go on birth control is to make your periods regular. So there's some women who get their period too often, like every 2 weeks, or maybe their period lasts longer than a week, or they just have irregular periods where they're chaotic and you never know when you're going to have your period. Well, if you go on a birth control method, then you should expect your period, depending on which birth control method you go on, of course, then you should expect your period every month. Sometimes women have periods that last longer than they should, like if they're lasting more than 7 days, or maybe your periods are so heavy that you have to use at the same time a tampon and a pad. I have some patients who sometimes go through a full pack of pads in one day. These are very heavy periods that might even be causing anemia or low blood concentration that can cause dizziness, lightheadedness, palpitations, like you feel like your heart's beating very fast. A good way to treat this is to go on a hormonal birth control method to control the flow of bleeding that you have. Number 4, some women who have very painful periods, if you go on a birth control method, the thought is that the pain that you have during your period will be controlled, or even we can go as far as giving you a birth control method where you don't have a period at all. So if you don't have a period, you won't have pain during the period because you're not having any. So this is another very good reason to go on birth control. Along the same lines, if you have been diagnosed with endometriosis, which is a condition that might cause painful periods and heavy periods, then going on a birth control method would control the symptoms of endometriosis. So for women who have been diagnosed with PCOS or polycystic ovarian syndrome, the treatment options if you're not trying to get pregnant is to go on a birth control method. So another syndrome that is treated with birth control is premenstrual syndrome or PMS. Check out my video on PMS if you're not sure if you have this. And some of the symptoms of this are being emotional, irritable prior to getting your period. So birth control methods are also treatment for PMS. And for those women who have a lot of signs of high testosterone like acne, or if you have a lot of excess hair growth in places where you shouldn't really have them, like your face or your belly or your back, or for women who have a lot of hair loss or alopecia, then the treatment for these problems is also to go on a birth control method to try to control the symptoms that high testosterone levels can cause. And lastly, going on a birth control method can reduce your risk of ovarian cancer and endometrial cancer. So this is also a good benefit of going on birth control because your ovaries and your endometrium are suppressed, or they're not in their usual menstrual cycle. You are reducing your risk or preventing the risk of ovarian cancer and endometrial cancer. All right, you guys, I hope you liked the video. Like us here on YouTube, subscribe to the channel, send me any questions to gynogal@gmail.com, and like us on Facebook. See you next week. Menstrual cycle and pregnancy. Progesterone can be used alone, like the progesterone-only birth control, or in combination with estrogen. There's basically 4 types of progesterone-only birth control. There's the progesterone-only IUD, the Mirena. The actual Mirena is just this tiny little T-shaped plastic device there. Once you have it placed by your doctor, you can leave it in place up to 5 years if you want to. If you don't want to have it in that long, you can have it removed.